The primary mission of the National Institutes of Health, or NIH, is to ensure all people lead longer and healthier lives. Since its creation, NIH has grown to be the world's largest source of medical research funding and the driving force behind decades of scientific advancements that have enhanced health, lengthened life, and reduced illness. The Office of Research on Women's Health, or ORWH, serves as the focal point for women's health research at the NIH. For over 30 years, ORWH has led a diverse portfolio of research programs, policy and planning initiatives, and research development projects aiming to enhance and expand research to improve the health of women across their lifespan. The office has also pioneered policies and strategies to promote the inclusion of women in clinical research and support women in pursuing biomedical careers. As the first public health service office dedicated to women's health research, ORWH ensures NIH is putting science to work for the health of women. And now, ORWH is honored to introduce NIH Director Dr. Monica Bertagnolli to share her vision for the future of research on women's health.
Hello, everyone. I am honored to be speaking to you today as the 17th Director of the National Institutes of Health and the second woman to have served in this role. I've had a long career as a cancer surgeon and researcher on the East Coast, but I started in a very different place. I grew up on a remote ranch in Wyoming where the nearest doctor's office was, and still is, 100 miles away. I was always interested in the applied sciences and considered becoming an engineer before deciding on a career in medicine. During my surgery residency, I spent 3 years conducting research on tumor immunology. A particularly compelling patient I encountered during my residency drew me to studying the genetics of colorectal cancer, sarcomas, and the inflammatory responses that drive disease, work that I pursued over decades, both in the clinic and in the laboratory. As my career developed, I became more and more involved in clinical trials and large clinical trial consortia because I saw how important it is to gather the evidence we need to make more informed decisions in healthcare. I've always admired NIH enormously, and so I was tremendously honored to be appointed the director of the National Cancer Institute in 2022. Never did I imagine that I would soon be participating in clinical research as a patient. Just 5 weeks after becoming NCI director, I was diagnosed with early-stage breast cancer. I am fortunate to be well now, and I feel deeply grateful for the medical research that led to my excellent care. Every treatment I received as a cancer patient was developed through NIH support. And I have calculated that I am indebted to more than 140,000 women who participated in clinical trials to test the treatments that I have received. I give you this personal background to help explain that my experiences have given me a powerful sense of the transformative potential of research and of the critical importance of access to research and its benefits for all people. Serving as NIH director, my main hope is to better connect research with everyday patient care. I want us to deliver truly evidence-based healthcare by integrating all forms of relevant data and by giving patients across the country the option to participate in clinical research. I believe patients should be able to contribute their healthcare information to the project of generating knowledge that can inform their own care as well as the care of others. Today, I am delighted to be announcing the launch of the NIH-wide Strategic Plan for Research on the Health of Women for 2024 to 2028. This plan will serve as a roadmap for guiding and informing NIH-supported research on the diseases and health conditions that affect women. The strategic plan aligns seamlessly with NIH's overall vision for biomedical research and was developed by leaders from across all of the NIH institutes, centers, and offices, along with external interested parties, federal partners, and the public. The strategic plan has 5 key goals: to advance research on the multiple biological, behavioral, social, structural, and environmental factors that influence the health of women, and to better understand how these factors intersect. To improve data science and data management practices. To foster career development for women scientists. To support basic and translational study of the biology underlying sex differences in disease and health for women across the lifespan. And to advance community-engaged science to improve the health of women. The Office of Research on Women's Health will partner with NIH institutes, centers, and offices to operationalize these goals. We will regularly evaluate the work that is done to assess how we are progressing. This strategic plan is one of a series of efforts that NIH has set in motion that align with the White House Initiative for Women's Health Research. I applaud the current administration's recognition of women's health research as a priority in the United States. NIH is eager to use all of the resources available to us to advance research in order to prevent, diagnose, and treat conditions that affect women uniquely, disproportionately, or differently. Many breakthroughs and discoveries are likely to be made over the coming years at NIH and beyond, thanks to the push we are making now to support women's health research. I look forward to supporting NIH in putting science to work for the health of all women. Thank you so much for your participation in National Women's Health Week.
To stay updated on women's health research efforts and activities stemming from the office, be sure to subscribe to our email list and follow us on socials.